right will advance it. Okay, so our next presenter is Xuqian Ma, who's a PhD student here at UC Berkeley, and she'll be presenting on prenatal air pollution exposure and early childhood cognition, the role of micronutrient powder intervention. Just a note for speakers, when we're doing the Q&A session, we're going to ask you to sort of briefly say the question that you received, just so everyone on Zoom can hear it well. So when someone asks you a question, you can just quickly paraphrase it again before you answer. And as well, for anyone who's asking a question, please just quickly introduce yourself. So your name, your discipline, and where you're based. So, thank you.
So hi everyone, I'm a second year health policy PhD student from UC Berkeley. And today I'm going to talk about a paper. This is originally my master's thesis program. And it's about prenatal air pollution exposure and its impact on people's cognitive development in early childhood, so children between the age of 0 and 3. And then I also try to explore the potential mitigation effect of a micronutrient powder intervention happened in rural China. And I think this is the most exciting part of my paper. And this is a joint work with my co-authors from Peking University, and I want to show my sincere gratitude to all their contributions. So let's get started. So as you can see the graph on the right, where the blue bars representing the percentage of children born in countries with NEPM 2.5 levels smaller than 10 milligrams per cubic meter. This number has been quite constant since 1990, and to 2008, this number suddenly escalated a lot. That's due to the success of Clean Air Act in the United States. But the magnitude of this number is still very small. It's less than 5%, which means that there are still a lot of babies born in countries with very high levels of PM 2.5 exposure. So we should care. Why do we care about this problem? It's because small babies, especially babies still in their mother's tummies, are very vulnerable to air pollution exposure, and this exposure can bring lifelong disadvantages. Since they were born, they may show lower birth weight, or they also show higher infant mortality rates. And in the long run, they can have a lower income level, lower education level, and also they may show worse health outcomes, such as higher risk of developing cardiovascular disease. So yes, so this is where our paper comes. So we try to explore the impact of prenatal air pollution on children's cognitive development when they were still very young. But we have very few causal evidence in this area. This is where our paper fits in, and later I'll discuss more about like how we designed this experiment and how we designed the causal work. So we focus on early childhood because this is the very critical time window for people's cognitive development. And I'll discuss more about this later as well. But even if there's a shock to our brain development at a very early age, our brain can still show a relative extent of resilience to the shock if corrective measures are taken early on. For example, like great nutrition or like more physical stimuli in their environment. So in this paper, we try to explore the impact of prenatal air pollution exposure on cognitive development, also the potential mitigation effect of micronutrient powder intervention. So the data we use in this in this paper come from a cluster randomized control trial happened in rural China, a province called Shanxi province. And on the next page, you will see more about this. And we find that the exposure of PM 2.5 during the first and second trimester of pregnancy are the most critical predictors of babies' later cognitive development. And also our micronutrient powder shows a relatively promising, I think, effect. And it can approximately mitigate 2/3 of the bad impact from this prenatal air pollution. Also, I'm working on more results. It shows that our intervention can also be more effective for children who like physical stimuli at their home. If you're interested in these results, you can email me and I can like talk more about this. So this is the map of China. The blue bounded region is where our study took place. And there are 11 red boundaries. Small regions are the 11 counties that we selected for the study. And in these 11 counties, we took all the 351 villages from these counties, except for the villages from the township of these counties, because those counties are wealthier, so we try to exclude these townships. And then we distribute randomly 2/3 of these villages as the treatment village and then 1/3 as the control. And we enroll all children born in the past year in these villages as the study sample. And at the beginning of the study, all children were on average 6 to 11 months old. And we in total enroll 1,802 children. So here is more about how we designed this study. So we enrolled two cohorts of children. So in April 2013, we enrolled the first cohort of children, and then we give them a baseline survey, and then we also distributed them a 6-month supply of micronutrient powder to their caregivers. And then after 6 months, we do a follow-up survey, and also we distribute another 6 months supply of micronutrient powder, and we just follow this pattern for 3 times. There are 3 follow-up surveys. And then for our cohort 2 children, we enroll this cohort 2 children from the same villages 6 months after we enroll this cohort 1 children, which means like if the village is a treatment village, then we enroll another cohort of treatment children from the same village. But if it's control, we enroll another cohort of control. So there can only be treatment in one village, and there can be only control in the same village as well. Yes, and then on the right, lower bottom, you can see a picture of our product. Yes, and this micronutrient powder contains a bunch of ingredients ranging from vitamins and folic acid and iron and zinc. So we don't really know which component is taking effect, but it's the combination of all of this are taking effect together. Yeah, and we it's a little bit unfortunate that we have a relatively high attrition rate in this sample in this study. About like 18.2% in treatment group and 15.57% of children from the control group missed at least one survey. But I have a table in the end showing that this attrition rate isn't affecting our treatment that much. If you're interested, we can like talk about this in the Q&A. And also important track of the study is that we also track people's consumption of micronutrient powder by giving the caregivers empty envelopes to store the consumed sachets, so that we can track consumption as well. Okay, So this is how we measure the cognitive outcomes in our study. It's called the Bailey Scales of Infant Development. It's a widely used tool to measure small children's cognitive development worldwide. Because small children's cognitive development are measured very differently from how we measure adults' cognitive abilities, because they tend to show a very early signals of how their brain work. And one of the sub-index from this measurements is called mental development index, which we abbreviate as MDI. And the other index is called psychomotor development index, which we abbreviate as PDI. So MDI measures what we usually think of as cognition, like sensory perception, knowledge, like how they use knowledge, memory, problem solving, and their early language skills. And PDI assess both gross motor skills, like how you run, how you walk, and like can you turn around. And fine motor skills measures people's like finer skills, motor skills, like picking up objects using their fingers. I remember there are also like can you smell or things like that based on your age. So these scales are based on the age of the children, and it's standardized into a normal score, and it has a mean of 100 and a standard deviation of 80. So this graph is showing you like how people develop their cognitive skills from a very early stage. So cognition development is a very hierarchical, has a very hierarchical structure. Like starting from very early, we develop like our auditory or visual skills when we were just born. And then later on, based on these skills, we start to develop like an eye-hand coordination skills or things like that. I have very bad eye-hand coordination skills, but that really distracts my learning as I grow up as well. Yeah, and then in the end, when children grow up, they start to develop their academic learning skills based on this very basic skills. And then next, I'm gonna talk a little bit more about how I developed the causal inference framework in my paper. So as we all know that air pollution is not randomly distributed to each one. So your level of exposure of air pollution can really depend on your values and your parents' education level and a lot of socioeconomic status. So I'm first briefly going through like how I calculate this air pollution exposure thing, and then I'll talk more about like how I deal with the endogeneity of air pollution exposure. So this air pollution exposure data come from a newly released product from Tsinghua University in China. And it has originally a 10 kilogram by 10 kilograms by day resolution. So that we first try to calculate the aggregate mean of PM 2.5 level in each county on each day. And then I try to calculate the trimesters of pregnancy for each child. So that for every child, we have first, second, and third trimester of pregnancy based on their weeks of gestation. And then I try to calculate the exposure in each trimester of pregnancy for each child based on the county he or she was located when the survey was conducted, and also based on his or her gestational period. So for children who were born on the same day and born on the same day and located in the same county, they have same exposures. Yeah, And I also checked whether the children were born in the same county as where they conducted the survey. So most of them do. Yeah, but there's still a little inaccuracy in this measurement. Okay, so this is how we deal with the endogeneity from the city due to the in random exposure to air pollution. So we try to use thermal inversion as an instrumental variable for air pollution, which means that we assume that thermal inversion is not correlated with other outcomes, but it's only correlated with air pollution exposure. So this graph shows you how thermal inversion happens. So usually, typically, warmer air is trapped under colder air so that the airflow can be natural and air pollution can be just taken away by the atmosphere. But when thermal inversion happens, colder air is trapped beneath warmer air so that the air pollution is also trapped near ground. So we have higher levels PM 2.5 at that time. Yes, so we calculate the number of days of thermal inversion in each trimester of pregnancy for each child. So this calculation method follows the same structure as the air pollution. Yes. So this is our empirical strategy we use for this paper, like how we measure the effect of prenatal air pollution, cognitive development. And later I'll go through like how we evaluate the effect of the potential mitigation effect of micronutrient powder later slides. So TI here on the right hand side, it means thermal inversion. So the number of days of thermal inversion in each trimester of pregnancy. And on the left hand side is PM 2.5, which is the level of PM 2.5 in each trimester of pregnancy. And we control for weather variables here. So the X here is average temperature in each trimester, also like cumulative precipitation in each, cumulative precipitation in each trimester. And we control for county and survey wave effects respectively, and also the standard errors are clustered, two-way clustered at the county and survey wave level. And here's the second stage equation for our empirical strategy. So as in the first stage, we try to validate whether thermal inversion is a solid instrumental variable for PM 2.5. And here we have validated this, so we come to see how PM 2.5 impacts cognitive development. So here we include all three terms PM 2.5. So we have first, second, and third trimester PM 2.5 on the right hand side, and on the left hand side it's Y variable here, whether it is the mental development index or it is the psychomotor development index. And we also control for axia, which include weather conditions, and also children's months of age, gender, and their caregivers' education level. And all the fixed effects and cluster randomized, standard errors are the same as in the first stage. And this is how we try to evaluate the potential mitigation effect of our micronutrient powder intervention. So everything is the same here, except for the A to T and the PI multiplied by PM 2.5 term here. So we add on this interaction term here to see how the micronutrient powder intervention can mitigate some of the effects from the prenatal air pollution exposure. And we do this for 3 times. So like each time we repeat this equation for 3 times. So each time we include the 3 terms PM2.5 and 1 term of interaction. So for example, we have like 3 terms PM2.5 and then we interact MMP with the first first trimester PM2.5 exposure and then the second. So this is how we do this. So here are the results. So this is the first stage results for our empirical strategy. As you can see here, that so for the first, second, and third column are correspondingly the first, second trimester results. These results are quite stable and robust, and we also test the robustness of these results, and the results are in the appendix, and we can talk more about it if you're interested. And this is the second stage results, which is the most core results in this study. So as you can see here, so from column 1 to column 4, we restrict this our empirical equation more. As we restrict this equation more, we can see the results are still quite robust, and the numbers are relatively constant. So if we multiply the number by 10, we see that a 10 milligrams per cubic meter increase in the first and second trimester of pregnancy can lead to approximately 2 or like 1 point reduction in MDI and PDI. So this is the results for, just now it's MDI, and this is for PDI. So the results and the are still quite constant, and the numbers are quite similar as just now. Here I show the mitigation effects of micronutrient powder. It's unlucky that this micronutrient powder doesn't work quite well for our MDI outcomes, so it doesn't work quite well for people's mental development index. I guess the reason, which I'm also exploring and doing more analysis right now, is because MDI really requires more physical stimuli with their caregivers and parents in order to improve, and micronutrients is probably not enough. And here's the result for PDI. It's interesting that our micronutrient powder intervention is effective at mitigating the adverse effects from second trimester pollution on PDI. So because second trimester is also considered as the most critical time window for people's for babies' cognitive development. So I guess that's why micronutrient powder probably can mitigate the effects from this trimester. Okay, so it's the conclusion. So in this paper, we find that the first and second trimester of pregnancy PM2.5 exposure have more impacts on babies' cognitive development at age 0 to 3. And then we also find that our micronutrient powder can mitigate approximately 2/3 of the bad effects from this. And the policy implication for our study is that we think our micronutrient intervention can be a cost-effective way to help people in highly polluted regions, but this is just can be taken as a complementary policy strategy, because the root cause of air pollution can only be tackled by the government with more solutions. Thank you.
This is Liz Long, School of Public Health. I was wondering if you could talk about how you consider indoor air pollution, given that different fuel sources can account for 30 times the amount of exposure to outdoor solutions, and different households might have used, some might be using LPG or electricity, some might be using like coal or wood.
Yeah, thank you. So your question is that how do we account for indoor air pollution, which is usually a worse problem in the developing regions? Okay, so that's a really great question. But I guess right now in the environmental literature, a lot of times people can just account for air pollution exposure based on satellite air pollution data because we don't have that many monitors in the region. But I think that's a very promising direction in the future.
Hi, I'm Leah Fernald in the School of Public Health. I think this is a really interesting presentation. I really appreciate your last policy implication about how really we can't just focus on micronutrient supplements, because the truth is there's really not a lot of evidence about micronutrient supplementation in terms of the global evidence. So I think I'm really very concerned about your second bullet point about this idea that you can connect the intervention and saying it's mitigating any impairment from air pollution, especially when you really don't have a sense of like what that causal connection could be. Because it doesn't sound like you have anything about fidelity or whether anything changed in terms of micronutrient status. So maybe you could just talk about, if you believe that second bullet point of your key findings, like what's your mechanism that would explain it?
Thank you. So your question is that what's the mechanism for whether micronutrient powder can be effective at mitigating this bad effects from air pollution? So this is something that I'm still working on right now. So to right now, I find some literature from medical science showing that micronutrient powder can mitigate some of the bad effects adults' health, like respiratory disease or something, but there's not much evidence on how this affects people's cognitive outcomes. I guess it's because not too many people measure cognitive outcomes in the past. Yes, but I'm still working on this. But I guess there's not too much evidence in this area so far. Thank you for your question.
Hi. Yeah. So I know air quality in Shaanxi province affected by the coal industry. So I was wondering, so when you chose the area to study, if there's any was surrounded by the war of coal industry that can also affect the child academic performance or like other intellectuality and stuff.
I'm sorry, can you repeat your question again?
Because I mean the area you study. The area you study, like have you ever considered the coal mine, the environment surrounded by the coal mine industry?
Yeah, do you mean like there's a lot of coal mine industry in the area and how does that impact the effect?
Yeah.
That's a really good question, but I guess the satellite air pollution data can capture these features. I think the satellite air pollution data are relatively good at capturing pollution from industries. Means this pollution can spread in the air, and satellite is good at capturing these features. But I guess it's worse at capturing household level air pollution. And we can talk about this more. Yeah, thank you.
So I just wanted to thank you. I think it's a really important area to explore. I'm not sure that we're quite there yet, but I think there's a lot of really exciting evidence. So two things, just a comment. I think there's a really great the emphasis group, which I encourage you to look at. They're doing some great work in Gambia and India, looking at DNA methylation and micronutrient pathways. And I think that that epigenetic orientation is a really exciting space for looking at cognition and micronutrients. The other question was if you considered some of the randomized control trial evidence around the micronutrient supplementation in infants and gut microbiome. And that determines that happens with the micronutrient supplements that are occurring. And sort of in many settings like Africa or South Asia, I'm not as familiar with China, so you have other things happening like environmental monitoring disease and all these other things. And many at different points, different environmental exposures happening. And so in terms of future health, what's happening down the road as we get this micronutrient. So I think there's no one answer, right? The answer is not don't take the supplements, but sort of looking at the bigger picture, the questions that sort of arise with potential solutions, that comes a new crop of questions along with that.
You
Yeah,
say your
thank
name
you.
also, we just want to make sure.
Sonia Navarro, I'm a senior volunteer.
Thank you. Thank you so much for your comments.
Thank you so much. Chef Raj from Yale San Francisco. I was wondering if you could expand a bit more on how dosing, how pre-meal nutritional behaviors may have been taken into account
Yes.
before the uptake of participants.
Yeah, thank you. I think your questions that I can explore more on the people's consumption behavior and also their nutritional intake before this study happens.
Yeah, and
Yeah.
also how did you consider specific dosing of the micronutrients within the supplement that you actually get? Because did you have information on like the specific amounts of the recommended daily intake amount for each specific supplement within this combined supplemental powder, or was it just a ambiguous serving amount that was given?
Yes, thank you. I think we do have some nutritional information in the study and trying to explore these results. Although the results are not causal, they are probably not too promising. But I do see that people with worse nutrition status before the study happens, or the people who I think benefiting more from this program. Yes,
Okay, great, I think we're gonna call it there so that we can
Yeah,
keep everybody
thank you.
moving, but